Hi, I'm Cherie Boyer. I'm acting as chair today on Sten Vermund's behalf, who is our chair, who is not with us today, but is on the phone, as I understand. I would like to welcome everyone to our fourth meeting of the Committee on Prevention and Control of Sexually Transmitted Infections in the United States of the National Academy of Sciences, Engineering, and Medicine. This project is sponsored by the Centers for Disease Control and Prevention through the National Association of County and City Health Officials. I'm joined by the committee members who are sitting around the table with me, and I will ask each of them to introduce themselves in a few minutes. But before we go further along, I want to note that this is an open, on-the-record session, and interested individuals have been invited to attend as observers. I would also like to remind everyone that this is an information gathering session. That is, the committee is in the process of assembling materials that will be examined and discussed in the course of making its findings, conclusions, and recommendations. Therefore, I ask everyone today to be extremely mindful that the fact that the committee has made no conclusions and that it would be a mistake for anyone to leave here today thinking otherwise. Comments made by individuals, including members of the committee, should not be interpreted as positions of the committee or the National Academy of Sciences, Engineering, and Medicine. In addition, committee members typically ask probing questions in these information gathering sessions, which may not be indicative of their personal views. The committee will deliberate thoroughly before writing its draft report. Moreover, once the draft report is written, it must go through a rigorous review process by experts who are anonymous to the committee. This is the fourth opening meeting of the committee and will include presentations and discussions of a variety of topics to fulfill the committee's information gathering needs and the public comment session. In addition to the presentations we will hear today, the committee has reviewed information relevant to its charge and will continue to gather additional information over the course of the study. Speakers' comments will be followed by questions and an answer period, and committee members will have an opportunity to ask questions. If time allows, we will open the floor to questions from other meeting attendees, that is, in-person and webcast viewers. At the end of the day, we will have a period of public comment, and audience members and webcast viewers will be able to ask and make brief comments. If you are viewing a webcast, there's an email for your comments. That email is stiprevention@ans.edu. Again, that's stiprevention@nas.edu. For the record, speakers will be asked to disclose whether they receive any funding or other activities related to the topics being discussed today and the sources of funding, for example, whether it's government, agency, or foundation funding. And for more information on the study, you can visit the project website at www.nationalacademies.org/prevent-STIs. Copies of the committee and speaker bio sketches are on display at the registration table and are also available on the project website. If you have any questions as the day moves on, please talk to our staff at the registration table and around the room. Their name tags, badges have a green sticker on it that says for staff. The meeting is being webcast live and recorded. Speaker presentations, slides, and videos will be posted to the project website 1 to 2 weeks after the meeting. A number of our committee members are not physically with us today, and I'll introduce them very briefly. We have Guillermo Prada, who's unable to participate. We have on the phone remotely Charlotte Gatos, Medina Aganor, Myron Mike Cohen, and as I mentioned, Sten Vermund. We'll now go around the table and have the committee members briefly introduce themselves, giving their names, current affiliations, and again, bio sketches of the committee members are available to read at the registration table. And I'll start with myself. I'm Cherie Boyer. I'm at the University of California, San Francisco School of Medicine, Department of Pediatrics, Adolescent Medicine.
I'm Kees Rietmeyer. I'm an independent STI consultant. I'm a professor at the Colorado School of Public Health.
I'm Sean Young. I'm associate professor. I have a split appointment in here at UC Irvine in emergency medicine and Department of Informatics, and direct the Institute for Prediction Technology.
I'm Ned Hook. I'm an emeritus professor of medicine at the University of Alabama at Birmingham.
I'm Jessica Willoughby. I'm an assistant professor in the Murrow College of Communication at Washington State University.
Hi, Charlotte. This is Sten. They obviously are delayed from what they had hoped to be, so I think they're assembled now.
Hi, Sten. When
Can
you
you all
talk,
hear us?
Sten.
This is Sten.
Yeah, we can hear you. When you talk, we all can hear you.
I see. Okay, great.
I think
I can
Charlotte.
hear you, but I can hear nothing in the room.
Do you all hear us in the room?
Yeah.
I don't. Could you send Yusuf and I don't know if she knows that we can't hear anything.
Okay.
Yeah, send her a note. I will.
Can we mute
Yeah.
them?
They are
Can we
muted.
mute them? Dangerous.
All right, I think we should continue with introductions, and in the meantime, we're working on whatever the problem is.
Hi, I'm Neeraj. I'm a professor of public policy at the University of Southern California.
Hi, I'm Patty Kissinger. I'm professor of epidemiology at Tulane University.
Sounds like it's working now.
Hi, I'm Sophie Yang. I'm a research associate at the National Academies.
Hi, Amy Mead, associate program officer at the National Academies.
Hi, I'm Carmen Zorrilla, professor of OBGYN at the University School of Medicine in San Juan, Puerto Rico. Most of what I do has to do with women living with HIV and pregnancy.
Hi, I'm Jeff Crawley with the O'Neill Institute for National and Global Health Law at Georgetown Law.
And hi, I'm Alina Selganikoff with the Kaiser Family Foundation.
Hi, I'm Vincent, Vincent Guillermo Ramos from New York University and from Montefiore Medical Center, the Adolescent AIDS Program.
Good afternoon, John Schneider, faculty at the University of Chicago and also at Howard Brown Health.
Hi, my name is Amy Geller. I'm the study director for this project.
Also, I mentioned that a couple of our committee members are not physically with us, and some are by remote, as you heard over the phone. And Sten Vermund, who is the chair of this committee, is the Dean of Public Health at Yale University. Guillermo Prada is a professor of Public Health and Sciences and the director of the Division of Prevention Sciences at the University of Miami School of Medicine. Charlotte Gatos is the director of Johns Hopkins Center for Development and Point-of-Care Tests of STDs at Johns Hopkins School of Medicine. Medina Aganor is an assistant professor of Race and Culture and Society in the Department of Community Health at Tufts University. Maureen Cohen is a professor of medicine and microbiology and epidemiology, associate vice chancellor for medical affairs and global health, and is the director of the Global Health Infectious Disease University at the University of North Carolina. And those round out our committee.